right, I think the attendees have come into the webinar. And it's 12:01, so I'll get started. I first like to acknowledge the traditional owners of the land on which we are meeting, and I pay my respects to the elders past and present, and the Aboriginal elders of other communities who may be here today. Good afternoon, everyone. Thank you for joining this month's webinar titled Winter Wood Smoke from Research to Policy Action. I'm Sabrina Idrose, a Centre for Safe Air Postdoctoral Research Fellow, and I'll be chairing today's webinar. So for every air pollution death we know, there are thousands of people who suffer from symptoms relating to air pollution, and one of the hardest hit groups is people who live with any kind of respiratory conditions. In Australia, residential wood heating is the single largest source of air pollution. Today, we are privileged to have two esteemed speakers, Dr. Nicolás Arriagada and Kate Garvey, who will shed light on this topic. Each speaker will present for up to 20 minutes, followed by a Q&A at the end, so please drop your questions and comments in the Q&A section below. Our first speaker is Dr. Nicolás Arriagada. Nico is a Swan Hearts and Minds Research Fellow and a postdoctoral research fellow at the Menzies Institute for Medical Research at the University of Tasmania. He is a multidisciplinary data scientist and industrial engineer specialized in environmental and medical sciences. He is a postdoctoral research fellow with the Centre for Safe Air. His work intersects modeling, public health, health economics, bushfire management, and more broadly, risks of climate-related and extreme weather events. During his PhD, Nico assessed the health burden of bushfire smoke in Australia and is currently working on novel methods to improve and refine population exposure estimates to wood heater smoke and landscape fire smoke, PM2.5, assess the health burden of different climate-related extreme events, and on using health economic and visualization techniques to better communicate policy-related research. Today, Nico will share some results from a national analysis combining an updated wood heater emissions inventory, a chemical transport model, and PM2.5 surfaces from random forest model to calculate exposure and the health burden attributable to wood heater emissions PM2.5. We're very glad to have you today, Nico. Over to you. Would you like to share your screen?
Yes. Thank you, Sabrina. I'm sharing now. Can you see the... Okay, yeah. Okay, so hello, everyone. And a big thank you to everyone at the Center for Safe Air who organized this webinar and for inviting me to speak. So Sabrina, Joy, Bill, and to my co-panelist, Kate. So winter is quickly creeping on us. So today I will talk about the health impacts of winter wood smoke in Australia. Okay, so first of all, I would like to acknowledge the Tasmanian Aboriginal community as the continuing custodians of Lutruwita, Tasmania, and honor Aboriginal elders past and present. So the talk today is based on this article that was published a few months ago, 1 month ago, in the Science of the Total Environment. But I will also link a bit to some of previous research I've done and other colleagues have done too. And I would also like to highlight that this work couldn't have been done without funding from CAR, now known as the Center for Safe Air, and without all of my co-authors, some of which are from the University of Sydney, the Hill Network, Curtin University, WA, and CSIRO. It was a collaborative work, as most of these things happen. So I would like to acknowledge all of them. So we know that there's quite a few studies that have looked into the health burden of wood smoke across Australia, but for specific locations. So for example, Sydney or Tasmania or some regional locations in New South Wales and the ACT. But this is the first attempt to try and integrate everything into one national assessment. So according to the Global Burden of Disease, a major global study on the causes and risks factors for death, air pollution is the leading risk factor for premature deaths, ranking 4th, with 6.7 million people dying every year, and just after high blood pressure, tobacco, and diabetes, so dietary risks. And just to compare some of these estimates, this is probably the highest estimate of deaths I found in the literature, which is 18 million deaths in 2 years, 2020 and 2021. So about 9 million deaths per year in the worst probably pandemic that our generation has lived, which totally collapsed and paralyzed the world. But when we think about air pollution, which is in a similar figure, so just under 7 million, we don't have the same reaction. I just want to highlight that we need to think more about these and the air pollution and the impacts and what we can do. So I've talked a lot about this, but I'm repeating because maybe there's people that haven't heard this talk or others. So there's a lot of evidence, epidemiological and toxicological evidence since the 1990s that has shown that air pollution affects health. And the main indicator is something known as fine particulate matter, which consists of tiny particles or droplets in the air with a very small diameter, so 2.5 microns. And just to get that sense, in the top left, you have a strand of hair with a diameter probably of about 50 micrometers. And then you have 5 blue balls, each of them with a diameter of 10 micrometers. That would be PM10 also. And then for each PM10, we would have about 4 particles of PM2.5. And given the really small size of these particles, these are able to pass the nose and throat and enter the lungs. And then they affect the respiratory and cardiovascular system. They cause systemic inflammation, oxidative stress. And when this happens on a large scale of either magnitude or a large population, health effects can be observed even with people dying. So this pyramid shows the range of health effects that have been studied for air pollution. And we have things in the bottom of the pyramid, such as, let's say, asymptomatic effects, like your lung function is slightly decreased when you're exposed to air pollution. And maybe most of us don't feel this. Some of us, which might have asthma, could be a bit more affected. But the thing is that when either the magnitude is higher or a larger population, or the people are more vulnerable, which tends to be people that are children, elders, pregnant women, and those with pre-existing conditions, we can start to observe more severe outcomes, such as deaths, hospitalizations, and increase in emergency department visits. And usually the top 3 levels are easy to measure and have been used in methods called health impact assessment to try and quantify the likely burden of attributable to air pollution. So how do we link this to wood heaters? So we all love this. It's very romantic, very nice, warm, like a movie, no? But the truth is that it's not always like this. Sometimes we have technologies that are not that up to date. We might even have just an open fire inside the house. And the older the technology, the higher the pollution that it generates. And what we can observe in locations where these technologies, these wood heaters are used, is something like on the right. So on the top, it's a picture of Hobart during winter, and in the bottom, it's a picture of Launceston. And a recent study that was published, well, not recent, but late 2019, early 2020, is a national survey of the use of firewood for space heating. This study found that on average, 13.5% of homes across Australia use firewood as their main source of heating. And doing a quick calculation, this is about 1.35 million households in Australia. That same survey estimated wood use across the different months. And you can see in this image in the top right, how that consumption distributes and increases during the winter months, which is a bit obvious, but it happens. And how can we observe this in the atmosphere? So we measure PM2.5 concentrations. And here we have a time series since 2010, just until 2016. in Launceston, and you can see a clear seasonal trend with increasing pollution throughout winter and decreasing to really low levels during summer. So I calculated the mean between October and March, that 6-month period is just 2.3 micrograms, which is really low. But you can see in some years, like I think it's 2013, there are measurements of above 20 micrograms. So that gap between 20 and 2.3 or something like that can be attributable to wood heater use. Here is another example. This is an average for Tasmania. In the top, we have hourly PM 2.5 from 2010. And in the bottom, we have a time series, this time of maximum and minimum temperature. And you can see clearly how air pollution increases as the temperature decreases. So different studies have looked at this and have used different methods to calculate what is the likely health burden of attributable to wood smoke. I did this in a study as part of my PhD, health impacts of ambient biomass smoke in Tasmania, which has a really dense network of air pollution monitors. And for this study, I'll just show some results. I calculated about 65 premature deaths per year and 70 hospitalizations per year, with yearly costs of just under $300 million, or we calculated this per wood stove, just about $4,000 per year. And other studies, Richard Broom and team, they didn't focus on wood heaters, but on a study they calculated that wood heaters was the largest single PM 2.5 source, so 1/4 of total anthropogenic PM 2.5, that is man-made, human-made PM 2.5, with an estimate of 100 annual deaths for the Sydney greater metropolitan region. Robinson et al. Did something similar for Armidale, New South Wales, a regional town in New South Wales, and calculated about 14 deaths annually, or $10,000, $11,000 per wood stove year. And this is the most recent one, which was done for the Australian Capital Territory. They calculated between 13 and 25% of PM 2.5 pollution comes from wood heaters, and between 11 and 63 premature deaths each year in a population that's quite small compared to the country. They use different methods to assess, but that was the range. So we use this framework, which was a 4-step framework. In the first stage, we compiled a wood heater emissions inventory using the best up-to-date statewide data. And that inventory was used as an input for exposure modeling. So all of that stage, or most of it, was mainly done by Stephen Vanderhorn from UWA and Martin Cope from CSIRO. I helped a little bit, but they led all that part. I just want to highlight that. So we used different techniques to distribute wood heater emissions across the landscape, and then used a chemical transport model, also known as CTM, to transform those emissions into PM 2.5 concentrations. Then we applied a health impact assessment for 2015. That was the year that, I know it's a bit outdated, but it was the year where we had most of the data, complete data that we needed. And then at the end, we combined these results with different modeling parameters, and then we assessed a hypothetical scenario of reducing 50% of the wood heater stove across the country with 2 different technologies, either electric heaters, assuming that they were using electricity that came from non-combustible sources, or high technology wood heaters, which emit about 1/6 of the emissions of what the current wood heater stock does. So just looking at some numbers, so residential wood use across Australia, you can see on the left a time series, and there seems to be a plateau after 2010. There's still a slight decrease, but we selected 2015, and my guess is that it reflects what is happening today. There might be a decrease in use of wood stoves, but there's an increase in population. So overall, it's pretty stable. And for those that don't know how the chemical transport model works, I'm just going to do something very raw, but what we have is we have sort of a depiction of reality where we have different sources of emissions: forests, transport, industry, marine vessels, agricultural sources, and different things. All of these have levels of activity and are producing emissions. These emissions combine in the atmosphere, and what we measure that is linked to health outcomes is what's happening in the atmosphere, which is concentration of particles per volume. And there's a lot of chemical reactions that happen, and these models that was led by Steve Ardenhorn and Martin Cope deals with this modeling and these reactions. We modeled this across Australia at 3 levels, 3 domains. So a big 27-kilometer domain that is grid cells of 27 by 27 kilometers for all of Australia. That's pretty broad. But then we zoomed in to a second domain level, which was 9 by 9 kilometer for the main states. And then finally a 3-kilometer domain, 3-kilometer resolution domain for the main metropolitan areas. So Perth, Adelaide, Melbourne, all of Tasmania, Sydney, and Brisbane. After we did all this modeling, we combined this by geographical areas, like administrative area level. For example, SA4s. So what is an SA4? It's a geographical area with a population that ranges between 100,000 and 300,000 in regional areas, and between 300,000 and 500,000 people in metropolitan areas. And there's a total of just over 100 SA4 regions across Australia. And what we can find here, this is wood heater emissions. Just to highlight in panel B, we can see that 3 of the top 10 SA4s are from Tasmania, and that's really huge. Like, well, it's expected because it is the coldest regions in the country, but maybe not so much because the population is so low that you might have not expected that. So we calculated also PM 2.5 concentrations attributable to wood heater smoke. That's the third column. So in the second column, we have the annual average, considering all emission sources, and then the third column is just the proportion that's attributed to wood heater use. And we can see things like almost 20% in New South Wales, which coincides with what Richard Broom and team calculated. 20% in Tasmania, which I think it's an underestimate in my study and the numbers that we've looked at in Tasmania. We think that it's about maybe 50%. Wood heaters is the main contributor to air pollution in the island, in the state. So, and the ACT 12.4%, which coincides with estimates by Sotiris Bardoulakis and team. We estimated in total just above 720 deaths per year, or earlier than expected deaths per year. But we did model various scenarios and estimated that this ranged between 550 and 1,500 deaths per year. And just to put these numbers in perspective, I know that they're not the same methods and different approaches, but for the 2019-20 bushfire season, we calculated just above 400 or 420 deaths because of that catastrophic bushfire event. So we could sort of say that every year we're experiencing, in terms of burden attributable to wood smoke, one Black Summer bushfire event every year, only from smoke. But we know that we can do something. So there are existing technologies that can help us reduce these emissions and therefore the exposure of people. We estimated the benefits of this hypothetical nationwide program to replace 50% of wood heaters across Australia, modeling 2 scenarios. On one hand, ultra-low emission burners, or ULEBs, which currently are not available across Australia, but they are in New Zealand. But Faye Johnston, who's in the audience, she is leading some work that seeks to assess how these stoves perform under Australian conditions and what would be needed to actually have them available. But current estimates simulating real-world conditions are that these stoves would emit about 1/6 of the current wood heater stove. So there's about an 80% reduction, or maybe a bit more, in emissions. And then on another hand, we assessed what would happen if we used electric heaters, and we assumed that the electricity came from non-combustible sources, just to not have to calculate the emission factors of the electricity generation grid. And you can have a look later at the article, but just to highlight, sorry, this happened the last time too. Sorry. Give me 1 second. Okay, so I'll calculate it that the health benefits of reducing air pollution from these sources ranged between, here you can see at the bottom, 1,500 here, 1,600.
Sorry, Nico. We can
Yes,
see your presenter's view, so maybe you should change
sorry.
settings. No worries. Maybe change it. There's display settings at this top, I think.
Oh, sorry. No, you can see.
Yeah, I think you can go to display settings. Yeah, and then swap.
There.
Yeah. Yeah.
There. Okay.
Thanks.
So thank you, Sabrina, for that. So you can see here $1,600 million at a national level. That would be the benefits of using these high technology wood heaters, and just under $2 billion if we were to use electric heaters. So obviously this doesn't include the costs and everything that involves doing this, but it's a start. Finally, also, as part of the work that I've been doing for the Center for Safe Air, I developed this visualization tool, which you can find online, or you might have received if you are in the Center for Safe Air newsletter. Sabrina, can you confirm you can see this? Sorry.
Yeah, we can see
Data visualization with heater pollution?
Yeah.
Okay, so yes, so this can be found in the Center for Safe Air website. It's a small summary of the study with a link with this dashboard embedded. This was done using a tool called Tableau, and we published some of the main results in this dashboard by different geographic aggregations. So in this filter, you can select state territory or greater capital city statistical areas, or SA4s. Then you can select if you want to see, for example, a specific state. For example, we can choose Tasmania. And then it gives you a ranking of the variable that you selected with a summary in the tooltip. And here we have the different variables. So wood heater emissions, population weighted PM2.5, then and the estimate of the earlier than expected deaths, and also that number normalized by 100,000 people, just so that you can compare across states. And then you can see geographically which is the location that is more affected. In this case, we have that the Northeast and the area of Hawaii are the most affected. So you're welcome to explore this and write to me if there's something that's not clear. And happy to get some contacts or some questions if you need to. Thank you very much.
Thank you so much, Nico. That was a very informative presentation, so thank you. There are some questions in the chat, but we'll come back to them after all the presentations have ended.
Okay.
Our next speaker is Kate Garvey. Kate is currently the Acting General Manager of the Mental Health, Alcohol and Drug Directorate in the Department of Health, Tasmania. She has worked in public health for over 20 years in a variety of leadership and policy roles in Tasmania, the Australian Capital Territory, and New South Wales. Kate has been responsible for the design, implementation, and evaluation of initiatives to improve the health and well-being of communities, building related research policy partnerships, and focusing on health equity. Her work brings together community knowledge, lived experience, practice, and research knowledge to support local problem solving. Kate has lived with asthma all her life and is aware of the first-hand impacts of wood fire heating. She also has 3 daughters, one who lived for a period with severe asthma. With the love of walking and nature, asking her and others like her to stay inside for a large portion of the year is not the answer to air quality problems. Today, Kate will share a consumer's perspective and touch on policy responses. We're thrilled to have you join us here today, Kate. Over to you.
Thanks. Thanks very much, Sabrina. So hello, everyone. My name is Kate and I live in Hobart, Tasmania. I love the cold and I love the outdoors. I'm lucky enough to live in a place where I can walk to work and live without a car, walking everywhere, and so do my family. As Sabrina's touched on, I lived with asthma all my life. And one of the aspects of my asthma is that I have significant seasonal variation with a major impact from wood fire smoke. Sometimes when I see or I hear that ad, Tasmania, come on down for air, I don't know if you've heard that one, but it actually makes me physically recoil. We have wonderful clean air in Tasmania at times, but also very poor quality air. It reminds me of something that my GP said to me when I was moving from New South Wales to Tasmania about 11 years ago. He said, "You'll be back. Tasmania is not a great place for asthmatics, but I'm still here." At a human level, being sensitive to wood fire smoke means that I have to have a gradual increase in the amount of medication I need to take as the wood fire smoke increases, as the weather gets colder. And this means an increasing reliance on oral steroids during the coldest months, and this really impacts on my sleep. I also need to make sure that I have my reliever inhaler always with me, something that I don't need to have at other times because my asthma is well controlled. And at home, I have to use home air filters in the bedroom and the living rooms of my house when it's really bad. I also use the aerator app to give me warning about times to travel, but you can imagine this isn't always that practical. My youngest daughter, for a period of her life at school, was unable to play outdoors during winter, something that it's very hard to explain to a 5 and 6-year-old. But she did have periods of her young life in hospital because of asthma. At one stage, my family had to move house because the neighbour, who had a slow combustion stove which was used for heating and cooking and used their wood fire heater every day, so we had to actually move house. Luckily, we were renting at that stage, but it really had a big impact. I was unable to use our backyard. So wood fire heaters, obviously, the smoke varies between the region because the poor air quality can sit around due to topography or due to wind patterns. So it's often hard to predict the impact. And when I read what I should do about this, it says I should stay indoors with windows closed. And obviously that's not feasible or desirable. Being a person who lives without a car and likes to walk everywhere, I'm very active. So it's also a tricky thing to deal with on an interpersonal level. I mean, you're not going to go and say to your neighbour, "Oh, look, you know, this is the impact you're having on me," because of course people aren't choosing to have that impact. People love their wood heaters. They're often more affordable, particularly in areas where people have their own wood, and they're very costly to replace. So it's really quite a tricky thing to deal with on an individual level. I'm not sure if anyone who's online has read it, but in 2020, Asthma Australia commissioned a nationally representative survey of over 25,000 Australians to understand how wood heaters were impacting on people, on both individuals and their community, but also what people thought about regulation if governments were to regulate. The research found that individuals are largely unable to protect themselves against wood heater smoke if they're at risk, and that the community was largely supportive of government regulation to reduce the impact of wood heaters. People mostly didn't understand how wood fire smoke was impacting on their neighbours. So in Tasmania, I think Nico talked before about some of the statistics, but about 13% of households rely on wood fire heaters as their main source of heating. And this, if you're living in certain areas, will collect. So even if there's a small number of wood-fired heaters, they can have a big impact. So I guess that's a human perspective. And then when we look at policy initiatives, it's really working out where the costs are borne, both the human costs, but also the financial costs. So estimates of the cost of health impacts have been from anything from $4,000 per year per heater up to $10,000 a year. And the total costs annually in Tasmania have estimated to be about $293 million in terms of health impacts. So sometimes it does help from a policy perspective to look at where the costs are borne and where savings can be made and how they can be used to support the costs of policy implementation. So when we're looking at what works in terms of reducing the impacts of wood-fired heater, Nicolás has talked about some of those, but it is quite a difficult thing to regulate because a lot of the responsibilities are shared across local government, state government, and the Commonwealth. So working out who's going to take the initiative can be tricky. Wood heater standards need to be legislated by state and territory governments to be enforceable. And also there is some criticism of these standards not reflecting real world heater use. State and territory governments are responsible for monitoring and regulating emissions, but often this role is delegated to local government who have less resources, particularly in a place like Tasmania where there are 29 local government areas, often with very small populations. So incentives such as buyback schemes have been effective, but are often not sustained, though it will be interesting to look at the impact of Act Smart, the wood heater replacement program in the ACT. And I guess that's just a little bit of background about me and some of my thinking about policy, but I'm very happy to take questions. Thank you.
Thank you so much, Kate, for sharing those valuable insights. Now we'll open the floor for any questions that the attendees may have. The first question is from Dr. Dorothy Robinson. So Dorothy has a couple of questions. She said that a nationally representative survey by Asthma Australia found less than a third of people are able to protect themselves from wood fire heater smoke when it's present. The first question is, what immediate practical policy improvements are needed to prevent wood heater users damaging the health of their immediate neighbours? For example, could there be changes to the definition of excessive smoke, allowing video evidence of the amount of smoke being produced at times when council officers are not able to attend, or PM 2.5 measurements that show the offending chimney is creating unhealthy PM 2.5 levels on the neighbour's property? Nico or Kate, do you have any thoughts?
I have no thoughts. Sorry, but it's not, I don't really know how this works. It's not my area of expertise.
No worries, Nico. And Kate, I assume you don't have any thoughts about this either.
No, this is not my area of expertise either. I guess in terms of practical policy improvements, I think there are some ideas about and some evidence around what policies would be effective, but I think some of it is about increasing public awareness about the impacts, as well as at the same time lobbying different levels of government to come together to work on practical solutions which are at different levels of government. But I'm not sure that answers that specific question.
Thanks, Kate. And for Nico, Dorothy pointed out that the graph for Launceston in one of your slides appears to show no improvement since 2010. Is that true?
At least from the graph, yes, it seems true, but that only goes until I think it was 2016. So I would have, for that period, it seems that it doesn't. I would have to look further into what happens until last year to be more precise.
Thanks, Nico. The next question is from Arabella. She's interested in what emission survey and inventory data that was available to you, because she said that there are critical data gaps for public access. For example, the National Pollutant Inventory, there's no data on wood heater PM 2.5 emissions, only PM10, which is critical information to paint a true picture of national emissions, especially for policy action.
Yes, so I think that the best would be to access the paper and look at the details there, but just we did notice that we didn't have the complete inventories for all the states. So for the ones we had, we used that data. For the ones we didn't, we had to do some assumptions. We also used I forget it's an energy survey that surveys the energy use every financial year or every financial year, and that was up to date for the year we were modeling, which was 2015. So we didn't use that one, the energy use and conservation from March 2014.
Yeah.
So we combined data sets from different sources to model this.
Thanks, Nico. Arabella also has concerns about the ultra-low emission study and promotion of clean wood heating. She imagines that the data is based on mass concentration of PM 2.5. High efficiency wood burners have been shown to emit high levels of ultra-fine particle pollution. Will the study address the particle count of ultra-fine particles versus mass concentration?
This study, no. So we looked at, yes, PM 2.5. I'm not sure if that will be addressed by some further work that will be done to assess the efficiency of this ULEBs, ultra low efficient burners, but that's interesting. Maybe that's something that we should consider. Thank you.
Thanks, Nico. And for Kate, there's a question on wood heater buyback programs. Their understanding is that they haven't been effective or seen much take up by the community, particularly in regional areas where there is a greater proportion of wood fire heaters. Do you have any insight to share about how we can make these programs more successful and palatable for wood fire users, particularly those who are unlikely to switch from wood fire heaters due to behavioral reasons such as an aesthetic attachment to wood fire or not considering switching to a lower emission source of heating at all?
So I'm probably not a specialist in this area, but I think that the buyback schemes have been more effective where they've been sustained over time and they've been combined with public information campaigns. So it is about using a range of strategies. I think also having public discussions about such things is also really useful, so people are able to engage and to increase their understanding, as well as the trade-offs for some of the wood-fired heaters with some of these electric fires that have the appearance of being like a fire, but without the emissions. I think that there are a range of things that have helped, but a lot of the buyback programs have been short-term, and then, you know, just not combined with a range of strategies. But Nico, you might have some comments about effectiveness.
Sabrina, could you repeat the question? Sorry, it was a bit long, so I phased out.
I was thinking that you may know a little bit more about the effectiveness of buyback schemes, you know, in the shorter term,
No.
whereas I think they are not sustained for long enough to measure kind of that there are immediate impacts. I think in Launceston they saw reductions in
There was a reduction in Launceston, but I think
about
that there,
60%, I think,
yeah, I think there might be
in the
a
short term.
limitation in the Australian context about how environmental regulation works. So from the experience that I have from Chile, they would ban them, so that if you were to change your wood stove, then you can buy it back. You know, like you can put it again in 5 years down the road. They're just banned. And there's an institution, the Environmental Enforcement Agency, that has to overlook that the regulations are complied with, and if not, you get a ticket, like an expensive ticket.
Yeah, so I think it's combining public education with buyback schemes, with changes to planning regulation in terms of new builds, plus also having enforcement. It's a combination of factors.
Yeah, we have something similar for transport. So the Euro 6, or you know, the emission regulations for transport, they're improving every year, but I don't think there's something similar for wood stoves that would limit the use of older, more polluting wood stoves.
Thanks, Nico and Kate. So Ingo had a question for Nico. So what are the estimated deaths per annum based on our cardiovascular causes included?
So in this study, we used a relative risk or dose response function that was recommended by the World Health Organization, that estimated the increase in all-cause deaths except accidental deaths with PM2.5. So that would include cardiovascular, respiratory, and probably those would be the main two. In a population aged 30 and above, so an adult population. But obviously it's an underestimate because everyone's affected.
Thanks, Nico. For Kate, so Arabella, thank you for sharing your personal story about the impacts of wood smoke on your health. As a community advocate for clean air, she hears heartbreaking stories every day. The ECT Office of the Commissioner for Sustainability and the Environment produced a report on wood fire heating policy to burn right being a failure, and advocated for phase out, which the government has adopted. Are you aware of this report, and will you support this position?
I guess I do support that position. Previously, I was part of the Asthma Australia Consumer Advisory Committee, and I supported their production of a paper, which I think Angela Cartwright has shared in the chat as well, the link to that. So yes, I am supportive of this position. I'm currently not in a position in government to be able to influence this, but I think there's lots of ways that we can advocate, including telling our personal stories. I'd encourage people to advocate from a range of perspectives.
Thanks, Kate. And for Nico, how did you measure PM2.5? Was there any off-the-shelf devices like the ones from Purple Air?
No, nothing from Purple Air. So the model, everything was modeled with this CTM. When we used two methods, I think I didn't talk about this because it was a bit too technical, but on one hand, Steve and Martin ran the CTM, so they configured the emissions of all of the different sources, like I was saying, industry, residential, different things. And they ran two scenarios, one for all emission sources and one without wood heaters. And the difference would give you the contribution of wood heaters. And then this was compared to the national PM2.5 monitoring station network, just to validate. But then we combined those estimates with an analysis that myself and some other colleagues from the Center for Safe Air are just finishing, which is a machine learning model that was used to predict daily PM2.5 across all of Australia at a 5-kilometer resolution. But that was trained with monitoring data from the national network. So we didn't use purple air monitors yet. As I understand, they're not validated, so you don't get the same values as a actual official monitoring station.
Thanks, Nico. Also, you noted that ultra-low emission burners could emit 1/6 of current wood heater stock emissions. Is that compared to the latest standard for wood heaters or to actual makeup of wood heaters at the state or national level? Noting that there is likely a significant amount of wood heaters currently in operation that are very old and have less stringent emission controls compared to newer models.
Yes, so what we used to model the baseline scenario, we used an average emission factor, which is the one that's used to construct a statewide emission inventory. So that takes into account old stoves, like a percentage of new stoves, medium, and then older stoves. And if I remember, that's about 12 on average, 12 grams per kilogram of wood used, I think. And the real life emission of a ULEP, it's actually lower than 1/6. It's 1 gram per, around 1 or 1.2 grams per kilogram. There's a paper that was led by Faye Johnston that has that estimate. But we decided to use a value of 2, thinking about, although they did measure that considering a real world situation. But just to be a bit more conservative, we used a value of 2. So that would be a 1/6 of what is currently used to construct the current emission inventories.
Thanks, Nico. Sophie had a question for Kate. Sophie asked, how helpful do you find using air filters in your home?
I do find them very useful. I was lucky enough to participate in some of the research that was conducted in Tasmania around use of air filters in houses. And particularly it looked at how leaky your house was, but also which of the air filters were better. So I do find them useful at a human physical level.
Thanks, Kate. That's great to know. And Christine asked a question for Nico. Is the estimate for New South Wales having the greatest emissions mainly due to the larger population and perhaps greater number of wood heaters?
Yeah, probably. Probably it has to do with that, with a larger regional population that uses wood heaters. Yeah, I would say so. Although it's not the coldest state, there are locations that are colder. For example, the Blue Mountains or around there.
Yeah, thanks, Nico. So Dorothy asked, what do you think about removing wood heaters when houses are sold? I guess this could be a question for both Kate and Nico.
Yeah, I've seen sorry, Kate, I've seen these interventions designed in Chile, and it's a bit easier. It's like when you're going to buy a new car, it already comes with the latest technology and the most up-to-date standards. So it would be easier to, yes, ban, let's say, new homes can only come with what we call heat pumps here in Tasmania. So electric air conditioning and heating. Yeah, I think that the design of policies is maybe a bit tricky and it's not really my area, but the technology exists to do things. It's whether how to implement it, who bears the costs. And who gets the benefits.
Thanks, Nico. Also, Kate, David said that you use the aerator app, which gives local outdoor pollution levels. Do you do any monitoring of air quality inside your residence?
I don't at the moment, but again, as part of some of the research that I've been involved with, I was able to get some feedback from the researchers. So that is a bit of a plug for putting your name out there for being involved in research. You do learn a lot about the technique. So no, I don't, but I kind of have a sense of what to watch for, and I do use the air filters in the house.
Thanks, Kate. And Michael asked if either speakers would like to comment on the role of Australian Home Heating Association in the public discussion about wood heater smoke.
I probably don't know much about that. I'm not sure if you do, Nico.
No, I don't know anything. Sorry, Michael.
No worries. So the next question is for Nico. So one particular problem with wood heaters is that they are used in exactly the meteorological conditions most likely to trap the pollution near the ground. Is this taken into account in your studies, or is it based just on emissions inventory data?
No, I'm not 100% sure, but I'm 99% sure it does take into account that, because what we do is that the emission, not the emissions, but the firewood use is distributed temporally and spatially across Australia, and it's modeled at an hourly level for a whole year, and it's combined with other data such as the planetary boundary layer height, which gives you the altitude of the stability of the atmosphere. So yes, on winter days, I don't know, cloudy winter days, you would have a low planetary boundary layer height and a more stable atmosphere. So you would have a higher concentration, and that's, yeah. So that was considered.
Thanks, Nico. So the next question is anonymous. So whether there are any resources individuals can use to help have a constructive decision with their neighbor about the impact of their fire on them, and any practical steps that the neighbors could take to reduce the impact. Or is it naive to think that this could even be possible?
I think there are various tools that are about burning wood better or doing the best you can with the heater you have. But I do think putting the responsibility onto individuals is very difficult. I think it's fairly marginal, and I do think that it's more at a policy level that we need to support people, because you can imagine having a conversation with your neighbour who's not really wanting to impact on your health. It's going to be a tricky one. I mean, I've talked to neighbours who've been burning off things in the backyard where it was much clearer because they were burning off plastics and things, and even that was very difficult. But I do think it's a hard thing to put onto individuals. That's why I think we need to have a broader discussion and really think about different levels of government responsibility, but also perhaps to think about, you know, in terms of changing the planning regulations when we're looking at environmental impacts and climate change. Generally, we should be trying to design buildings that have reduced need for heating or cooling. So I think some of the changes in standards there could really make a difference. And there have been some major changes in Europe where social housing also is built in these kind of ways that really has very limited need for heating and cooling. So that may be another frontier, though it can be quite costly.
Yeah. And do you think that the increased cost of living and homelessness has impacted the type of materials people are burning? So this is a question by Sharon.
I think the increased cost of living definitely has an impact. And I think people are very reliant on burning what they can get their hands on, and sometimes that isn't wood that is suitable for burning. And that does make having the conversation with your neighbour even trickier when you know that sometimes they might be struggling. So it's another whole dimension, really.
Thanks, Kate. And Liz is asking Nico about ultra low emissions wood heaters. So she lives next door to two households with wood heaters. And they have asthma, including the kids in her household. Can these new wood heaters guarantee that the emissions will be 1/6 reduced, or is it still down to operation? Also, is it okay to be continuously exposed, for example, for young children, even if it is greatly reduced?
So I have a disclaimer. So this is an assessment that it's a project that's ongoing. So the first assessment was done in New South Wales using similar wood to the wood that's used here in Australia, and simulating real world use, like conditions. So like you open the stove, some of it is wet, and like a real world operation. But this hasn't been assessed in Australia, which is a second step. And yeah, I would say that they are. It's just the results are promising. So you probably can guarantee that the emissions will be reduced. But also, if you're continually exposed, whether it's to 1 or 12 or something, that there's going to be an impact. So any activity that combusts and emits pollution affects you somehow. So yeah, I don't know. I don't know if I would say that the impact is greatly reduced, specifically to those 2 children that live in a house next to a polluting house.
Thanks, Nico. Also, Timothy asked if you could expand on the wood heating smoke inventory. How do you estimate the use rates in SA4 areas? Is there some statistical downscaling or inference from heating degree days?
No, we did use heating degree days, but what we did was we did all the analysis at these 3 domains, so 27 kilometer, 9 kilometer, and 3 kilometer. Then we combined all our results at a 3 kilometer resolution, and once we had all the modeling and the PM2.5 concentrations at that level, we extracted population weighted PM2.5 at SA4 level. So all the CTM was run at the same, I don't know, say spatial domain level, the 3 kilometer one.
Thanks, Nico. So we're reaching to the end of the webinar. So I just wanted to extend my sincere appreciation to Nico and Kate for their excellent presentations on this topic. We hope that attendees have found the information valuable and insightful. Sorry, we did not manage to get through all the questions today, but we'll pass them on to the speakers and be in touch with you soon. If you have any further questions or would like additional resources, please don't hesitate to reach out to us. And we look forward to seeing you at our next webinar. Thank you and have a wonderful day, everyone. Bye.